Anaheim, May 21st, aitmed, a high-tech company dedicated to revolutionizing the medical industry, has announced its business expansion through cross-funding. This move has garnered significant attention from investors and brought new opportunities and transformations to the medical industry. aitmed core product is a software that can generate medical reports in real time based on doctors' conversations. The software is also equipped with an intelligent medical assistant that can help doctors receive patients, significantly improving diagnostic efficiency. The launch of this software aims to reduce doctors' workloads and enhance the quality of medical services. Through the cross-funding model, aitmed allows each investor to not only gain equity but also use its innovative software for free for a year. This software system will help doctors quickly generate professional medical reports during busy consultations, ensuring the accuracy and timeliness of every medical record. Additionally, aitmed promises to create a 15-minute video for each investing doctor, helping them showcase their professional skills and diagnostic experience. These videos can serve as personal branding tools for doctors, increasing their visibility and credibility among patients. To further optimize doctors' workflows, aitmed has also launched a virtual nurse service. This virtual assistant can help doctors understand patients' conditions and provide real-time analysis and suggestions, assisting doctors in making more accurate diagnoses and treatment plans.
How would you rate the intensity of the pain from 1 to 10? Please choose one of the following options.
This service will significantly improve the efficiency of medical work and reduce doctors' workload. Gary Chen, the founder and CEO of aitmed, stated, "We believe that cross-funding is not only an innovative way to raise funds but also a bridge for mutual benefit with our investors. Through this method, we can secure the necessary financial support while allowing more doctors to benefit from our innovative technology, collectively advancing the medical industry." aitmed is a company specializing in medical technology innovation, committed to improving the quality of medical services through advanced technology. The company's main products include real-time medical report generation software and intelligent medical assistants, aiming to reduce doctors' workloads and enhance diagnostic efficiency. aitmed collaborates closely with investors to drive the continuous development of the medical industry. aitmed, innovative financing model and high-tech medical products have already attracted widespread attention, drawing the participation of numerous investors and medical institutions. In the future, aitmed will continue to focus on technology development and service optimization, promoting the digital transformation of the medical industry and contributing to the advancement of global healthcare.
Okay, doctor, how about let's talk about the memory. When people get older and older, maybe they lose their memory, right?
Yeah, with people living long lives and with the change in the society and all the changes that are happening, it has been seen that as we grow old, the risk of dementia, which is basically the memory problems, has been increasing a lot. And it is really hurtful to see our loved ones seeing them go through this when they're having difficulty remembering their loved ones and difficulty remembering their cherished memories and also functioning in an effective way on a day-to-day life. So it is a chronic problem, and it is an upcoming problem with all the baby boomers getting old and all the people reaching 80s, 90s. We are seeing more and more dementia happening and more memory problems. But what we have to keep in mind here is that there is two types of dementia. One is reversible and one is non-reversible. So there can be some instances when there is some vitamin deficiencies like vitamin B12 deficiency, and also the thyroid problems and depression and anxiety, which can be causing the symptoms which seem like memory problems or which seem like dementia. But once you fix the problems, the memory starts getting better, the people start getting better, and you can see the good outcomes, and people start feeling better. What we have seen is that a lot of depression is underdiagnosed in elderly population, with the loneliness and with the with the society, the way the society is, and not having too many people to talk to, and the depression is on the rise. So loneliness is here, which is causing the depression to increase, and depression can present as a memory problem, which can be a dementia, which can be misdiagnosed as dementia. So whenever somebody presents with the initial presentation of memory problems, I think the first step is to make sure that we rule out the reversible causes. So once we see a patient, let's do a thorough history, which is most important. Like they say, history is the most important of anything. So when they present, we have to see, ask the relevant questions, how long it has been happening, what is the precipitating factor, and how is the progression? Is it like intermittent, gradually progressing, or totally fine, totally worse? What is the pattern here? And what things make it worse and what things make it better? And then also another component to ask is which memories are being lost, whether it is the new memory that is difficulty registration of the new memory, or whether it is the old memory which is getting lost. So all these questions can help in seeing what is the underlying cause of dementia. But once the reversible causes have been ruled out, then the question here is, what is the stage? What are we looking at? Is it like initial stages? Is it like a moderate, or is it like a severe dementia? Thankfully, most patients present with the initial presentation because of the good access to healthcare, but at the same time, due to socioeconomic factors, some patients or most patients, they might not present at the right time to evaluate at that time. So what we see is that when somebody presents, the good thing to do is to do a mental status exam. There is different type of tests you can do. One of them is called mini mental status exam, which has different components. When you ask them to repeat something, subtract the numbers, speak something backward, draw some designs, draw a clock. I mean, there's different modules which you can do, and ask the patient to check on that if they're alert, awake, oriented to time, place, and person, and depending on that, we will see what the score is. So like on this exam, which is MMSC, which is the mini mental state exam, just as a reference point, 0 to 10 point score is like severe dementia, 10 to 20 is like moderate, and 20 and more is like mild dementia, depending on the points that they get over there. So at the end of the day, when you see the patient who is having dementia and they're also presenting with the symptoms, and you are on the track that it is going on, then you don't need much imaging tests. The MRI, CTs are not recommended to confirm the diagnosis. If it is an early stage and more like young patients or middle-aged patients starting to have these symptoms, then imaging studies like CT and MRI can be done to see if there is any thing which is going on, which is causing it prematurely. But if an elderly patient, it is happening and it is gradually progressing, there is no need for any advanced imaging studies or anything. It is basically a diagnosis based on how they are doing. When you see the family members, you can also ask them about what the situation at home is. Are they able to do the activities of daily living? And how are they interacting with their relatives, how are they interacting with their friends, if they're hallucinating, if there's any particular time of the day which is bringing it on, and how the progression has been on. Activities of daily living is basically the guiding light in determining if the patient is able to take care of himself, or if we have to start looking for disability or nursing home placements, depending on how bad the situation is. It is really painful for the loved ones to see their loved ones going through this, but at the same time, what is important is that the proper care is taken care of, and make sure that there is all the needs are being catered to. So depending on those findings, we can see, and thankfully these days there is like new technologies and new treatments coming up. There has been some promising treatments for Alzheimer's, which is the most common, but we are still in the phases at this stage. Until a conclusive treatment is being found, it is important that we diagnose it appropriately and take all the appropriate measures to make sure that they are not at risk, and they are at comfort, and everything goes smoothly for the patient and the family.
Thank you, Bala. Thank you guys for your watching AM Health channel. Bye bye.
In the modern realm of healthcare, a visit to the doctor transcends the traditional exchange of questions and answers. Enter the era of technological collaboration, where the synergy between human expertise and aitmed revolutionizes the patient-provider interaction.
Hi, Anne. I'm Renee, the physician assistant on call today. How are you?
I'm fine.
As the dialogue unfolds, the aitmed app silently observes, its virtual gears turning to create a comprehensive report that captures the essence of the conversation. AI-aided generation of providers' notes and SOAP notes, ensuring precision and efficiency in medical documentation. AI medical coding and transcription services seamlessly integrate into the healthcare administrative landscape, eliminating the cumbersome nature of paperwork. With time-saving features, the technology effortlessly produces high-quality reports, empowering healthcare providers with insightful data. Voice recognition takes center stage, presenting itself as a superior solution for hands-free operation, embracing advanced technology for a seamless experience. Automation extends to ICD and CPT codes, simplifying the intricate process of billing and insurance, enhancing accuracy and reducing errors. Workflow optimization emerges as a key feature, promising healthcare providers a smoother, more efficient operational process. The promise of increased revenue per visit and a reduction in claim denials becomes a financial incentive, illustrating the aitmed platform's potential to positively impact the profitability of a medical practice. Embracing the marriage of human care and aitmed's technological prowess, it stands as a beacon of progress, redefining the future of healthcare one automated task at a time.
Okay, Dr. Bala, can you talk about concussion topic?
Yeah, I'm glad you brought it out. These days, as we see that there's a lot of athletes on the field, especially with the football, and what happens is that while they are playing and while the adrenaline is acting and they are in the middle of the game and everything is happening, they can get injured on the head. It is a pretty engaging game, and there is a possibility that they can get hit on the head and the concussion can happen. And the concussion has been shown in the past to be bad on some athletes on the field, and we have the visuals and from the games from the past, and where there could be some serious life-threatening reactions to the head injury also. So what is important is at this stage is to make sure that when a person or when an athlete is on the field and he starts having symptoms after an apparent head injury, it is important to diagnose and evaluate the kid at that time to see and make sure that the symptoms are not severe and life-threatening, and at the same time the precautions to be taken to prevent any further complications. So during the game, if there is a significant head impact and if there is a significant head injury, the athlete may come out presenting with headaches, dizziness, ringing in the ears, some blackout, and then some tiredness, fatigue. So at that stage, it is important to see the severity of the symptoms and then decide whether the athlete can go back to the game or whether the athlete needs to be removed from the game. And the further treatment of concussion depends on follow-up. So once you see a person or an athlete with the concussion, which can happen in any game or any injury, you have to evaluate the signs and symptoms and see where the patient stands, how severe the symptoms are. Most likely these patients present with headaches and bright light sensitivity and tiredness and fatigue and mental fog and ringing in the ears. So once you see these patients, and then it is important that you keep the patient off the sports. So especially the athletes, when you see them and then you tell them that the concussion is there, they do not like this and they want to return to the game. But it is important that you explain the severity and explain the complications and explain to them that it is important that they take a break till at least the headache resolves. So it has been shown, and there has been a condition, it's called the second impact syndrome. So what it means is that if you have an initial injury, which is through concussion, and if that has not properly resolved and you go back and you get hit second time on your head, it can leave some lasting memory problems and some lasting damages. So that is what we are trying to protect here or trying to prevent here from happening. So it is important to explain all this to the athletes and explain them that till the headache resolves, they should take it easy. So the athlete should be seen on a regular basis, and athlete should also be educated that till the day the headache resolves, the person should not be engaged in any strenuous activity. So once the headache resolves, then they have to return gradually, which is like a gradual program back to the full sports. So what we would suggest is, which is like a rule of thumb or basic like layman's term. So the headache is resolved. So the next day you start walking. So if you can walk for a couple of like half an hour, 1 hour, and the headache is not there, that's a good sign. But if the headache starts coming back when you're walking, you have to stop and go back to the resting. So once the day passes and you can walk without headache, the next day you can say that you can go to the brisk walking. So the next day they go to brisk walking. The following day you can recommend them that they go to jogging, and after that the next day they can go to running, and in this way gradually they can go back to the full contact sports. But if in any day, say they are good on the walking, they're good on the brisk walking, they're good on the jogging, but when they start running, the headache starts coming back. So it is recommended that they stop it and they go back to the previous day. They start brisk walking again, they start jogging again. So it is like a back and forth and gradual return so that there is no more symptoms on the day that they are going back to the full play and the full engagement activities. So in this way, we can prevent what is called the second impact syndrome, and we can also prevent any long-term problems and long-term complications from the head injury with the athletes. But this is the guidelines. There have been different guidelines and there have been different schools of thoughts. But the basic premises is that the athlete should be protected while the headache is going on, while the symptoms are there, to prevent the further complications. And these days, thankfully, the doctors, the trainers, the coaches, everybody is well aware and well educated about the concussion, and it has been taken care of in a great way. But still, it is important that the education is there for the new athletes so that they understand and make sure that inadvertently there is nothing bad happens and they are on the right track to the recovery. Thank you.
Thank you, Bala. Thank you guys for your watching AM Health channel. Bye bye. Okay. Thank